This segment of DelmarvaLife is brought to you by TidalHealth.
Valentine's Day is in 1 week. I'm going to repeat that, 1 week. However, while we're going to be talking about other things about Valentine's Day, we do like to spend a lot of time discussing all matters of the heart, including heart health.
Yeah, February is Heart Month, and that means we're giving our heart experts some time here in historic Studio D, and they include Jeannie Ruff. She is the Senior Executive Director of the Guerreri Heart and Vascular Institute, and Dr. Rajiv Dhawan. He is an interventional cardiologist. Thank you both for being here this afternoon. Good
Thank
to
you
see
for having us.
Yes, thank you. It's great to be back. Once a year, I can't let a
I
February
know,
go
every
by without
February.
being here. And now we have Dr. Dhawan. It's really a great day.
Yeah, it is, and I want to talk to Dr. Dhawan because this is your first time here. Tell us about your background.
So I'm an interventional cardiologist. I originally come from India, and I've been trained in 3 different continents in the field of medicine.
Really?
I've been trained in India, followed by my 5 to 6 years training in England, and then I started my career in the United States.
Let's talk for a second about heart disease, because I guess the statistics are just absolutely staggering, aren't they?
Yes, it is. It has been increasing primarily because we have to focus on the primary care, primary health care to prevent the cardiology disease, because many patients do have the family history of heart disease.
Right.
They may not smoke, but they may exercise, but they do have family history, and they may have a high cholesterol, which needs to be addressed.
And Jeannie, you know, we're talking about the risk factors. There are ones that you can control, and like you said, there's others you can't. And, I mean, I might be like, hey, you know, I exercise, I eat right, I'm good.
Well, and that's where it's so important to know what those risk factors are. The risk factors you can't change certainly is your family history, and if there's a blood relative under the age of 50 who's died of a heart attack, that certainly can predispose you to at a greater risk. Another risk factor is the older we get, the greater our chance. The wear and tear on those vessels just take its toll over time. But even with the technology that we have in treating cardiovascular disease, it's still the leading cause of death. 1 in 3 of us will die of some form of heart disease.
So you're talking men, you're talking women. I guess one of the first things comes to mind is a heart attack. The symptoms are different between a man and a woman.
Yeah, so mainly the woman generally will present with the very atypical symptoms, you know. There could be a dull chest pain or a shortness of breath. The men generally present with the very classical symptoms of chest pain, like a pressure on the chest and with a profuse sweating symptoms.
Yeah.
So, Dr. Dhawan, as an interventional cardiologist, what do you do? Where do you come in?
So basically, I am an interventional cardiologist, but for my patients, I'm a plumber.
Okay.
I do the plumbing of the arteries. So basically my job is to open those blockages and then put the stents inside. And after that, my role starts on the focusing on the secondary prevention. Disease already has happened. Now you need to really focus so that it does not happen again.
And you're with TidalHealth Nanticoke in
Yes, I am.
Seaford. Talk to us about the cardiac services that are available at TidalHealth, because it's really extensive.
It really is exciting over the past 2 years to have this system approach of cardiovascular services, now with TidalHealth Nanticoke and TidalHealth Peninsula Regional, plus our medical partners, which is all the employed physicians and the number of facilities and cardiology offices that we have throughout the Delmarva Peninsula.
TidalHealth has our heart covered.
No
We
kidding.
do.
Yeah.
Got that right.
Jeannie and Dr.
Thank you
Dhawan,
so
thank you
Thank
so
you very
much
much.
Thank you
for
all.
coming in.
Thank you.